With the Fall 2018 release, you can now document a transition of care visit using a new visit type and template in the Next-Gen Adaptive Content Engine. The new steps will fit easily into your existing workflow for documenting the patient visit, and the result will be the ability to submit the correct CPT codes for transition of care visits. Transition of care services are provided to discharged patients who have medical or psychosocial problems that require moderate or high complexity medical decision-making. Patients who need these services can be discharged from an inpatient acute care hospital or inpatient psychiatric hospital, a long-term care hospital or skilled nursing facility, an inpatient rehabilitation facility, a hospital where the patient was admitted for observation or partial hospitalization, or a community mental health center where the patient was partially hospitalized. The 30-day transition of care management period begins the day the beneficiary is discharged from the inpatient hospital and continues for the next 29 days. The provider can call or email the patient or have a face-to-face visit, but it must be done within 2 business days after discharge from the hospital. The provider must complete medication reconciliation and management no later than the date of that visit. The new Transition into Care template and workflow will help providers document these visits so that the correct CPT code is selected and sent for payment. Let's explore the new workflow. Reviewing the chart for a patient and need to document the transition of care encounter. To begin, click the Templates button. Next, click Intake and then click OK. In this case, the specialty was selected by default, but the system prompts you to choose a visit type. The Transition into Care type is further down the list, so to scroll down, click here. Now, click Transition. Let's close the History toolbar to make more room. To do that, click this button. The link to the Transition of Care template is on the General panel, but you can also find that link on the General panel of the SOAP template. Next, click Transitioning into Care. To expand the Transition into Care Management panel, click this button. The panel expands, and at the top is the Transitioning into Care checkbox. This checkbox will be selected by default if a summary of care document has been manually or automatically added to the associated requests or the summary of care documents received grid. In this case, that document has not been added to either grid, so the checkbox is cleared. To mark this as a transition to care encounter, click the checkbox. The next step is to document the patient's interim history, so you can document when the patient was in the hospital as well as the discharge details and date. Click Interim History. The Interim History window has been changed slightly for the Fall 2018 update. The hospital label has been changed to Facility, and there are a few new fields: Admitted From, Discharge To, and Discharge Diagnosis. Those enhancements are covered in a separate lesson, so to save time, I'll complete these details for you. Click Save, and then click Close. Next, you must document the other transition of care details. Click the Discharged field. Click this date, and then next, to document how the provider made the initial contact with the patient post-discharge, click this field. For this example, click Telephone. To save time, I'll select the date of the initial communication for you. You can document up to 4 discharge diagnoses. In our example, there is only one, so click the first Discharge Diagnosis field. A window displays so you can search for a diagnosis. The search field is already highlighted, so for our example, type angina and then click the search button. The correct diagnosis is highlighted, so click Select. At the bottom of the window are a series of questions related to the visit. Each question has a yes or no answer, and of course the answers you choose depend on the visit. To save time, I'll complete these questions for you. Now click Save and Close. Next, you'll document the patient visit as you normally would, recording the vital signs, documenting the physical exam, and so on. However, for the Transition into Care workflow, you must reconcile the patient's medications, which you can do on the Medications panel of the Intake template and on both the Clinical Reconciliation and Medications modules. The steps for doing that haven't changed, so we'll proceed as if that step, as well as the documentation of the patient visit, have been completed. As with most visits, the last step is to complete the evaluation and management coding on the finalized template, which helps determine what you get paid. Let's do that. Click the Finalize template. To expand the Evaluation and Management Coding panel, click this button. Notice that this checkbox is already selected. That's because we selected the Transition into Care visit type and completed all required steps, such as documenting the visit and reconciling the medications. One of the main objectives of this new workflow is to ensure you can generate the right CPT code for the visit, and to do that, you need to document whether the visit was moderate or high complexity. These codes indicate that the provider performed a face-to-face visit within a certain time frame. If you select moderate complexity, the system will generate CPT code 99495. This indicates that you performed transitional care management services with moderate medical decision complexity within 14 days of the patient's discharge. If you select high complexity, the system will generate CPT code 99496. That indicates you performed these services with high medical decision complexity within 7 days of the patient's discharge. Let's see how this works. Click Moderate Complexity. Now click the Calculate Code button. Code 99495 is generated. And that's it. Now you know how to document a transition to care workflow.